everybody part.
Can I get to that in a minute?
Sure.
Because that's probably our biggest lesson. We have a framework, as we call it, that is essentially our guide for communities who want to actually take the data and turn it into something. But that's a great question, because that's also where you can spin and do what we call process paralysis. Right? You just get stuck. Any other questions on this part? Yeah.
I totally get the outcome piece.
Yeah.
I assume the partners are still measuring inputs as well.
Mm-hmm.
So eventually you can figure out what levers are changing things?
Yes, that's a great question, and I'll talk a little bit more about that, but it's absolutely critical, and actually Hannah back here could talk probably more about this, but you definitely need to know what your North Star is, right? But then you also have to be willing to identify what some folks in another site nationally refer to as contributing indicators, which we now refer to them as well, which would be things like attendance. Well, these aren't K-12 outcomes, but attendance is clearly a contributing indicator to that big outcome. So can we follow that as well? But then also, what are the programmatic inputs, right? Are the mentoring programs even thinking about attendance? And if they are, what are they doing about it? So you have to understand all those things in order to really understand why a dial is turning in the right direction. Yeah. Any other questions on this? Yeah.
I just had a comment. I think there's a simplicity in what you put here, Jeff, that actually belies a really difficult trust issue, and that is you have named the institutions and you are publicly reporting the data on these at an institutional level. And that takes an enormous amount of trust on the part of those partnering institutions to allow that to happen.
Yeah.
And that's a huge piece of the collaborative work that undergirds the data issue.
So there's this, we have a lot of mantras, because one of it, in that visual that I had of the schoolhouse, we believe that there's this thing called mental models, right? And all of us in here experience education pretty much the exact same way. The quality varied, but we all had a teacher, right? An instructor of some sort who stood and gave us knowledge, right? There were probably desks or something like that. There was probably a chalkboard or something like that, right? So you have to change people's thinking by kind of hitting home these mantras, or whatever you want to call them, sayings. And one of them is shared accountability and differentiated responsibility, right? And the idea being is that when you bring together these cross-sector partners, everybody in that room has to say that I play a role in every single one of those outcomes. I somehow contribute to that, whether it's with my own kid alone or with 50,000 kids in the school district I work for, right? But we also recognize that certain people have more responsibility. But when this data comes out, say these arrows were red, everybody needs to step up on a stage with the leader of that institution and talk about what the plan is for getting to better results, rather than pointing fingers about why we happen to get there right now. And our sense is that's what builds the trust, right? And so we had one report card where one of the districts was all red. And rather than everybody looking at that district and just pointing at it, everybody actually wrapped their arms around them, and now that district has some of the coolest things going on in our region. That's the stuff that builds trust, right? All right, so let me get to some of the lessons. All right, there's three big things, to be quite frank. And it's essentially that civic infrastructure that is built around a cradle-to-peer vision. And I know the word cradle gives some people the willies. So I'm not saying that we've got to use that in every community. That's just our language, and we encourage people to take this and tailor it to meet their own needs. But in order to achieve collective impact. So just to give you this definition of collective impact, very early on in our work, we had no idea what we were doing before FSG gave us the name. But the head of the Greater Cincinnati Foundation, a guy named Rob Reifschneider, called me into his office and he said, listen, I just want to talk about what we're trying to do conceptually. This is what we're trying to do conceptually. And I don't have it quite all figured out, but he said, when the United Way was starting this thing called the Community Impact Agenda in our community, everybody was an isolated impact, right? He said everybody was doing their own thing. If you think about this as different systems, or you can even think about it as like 5 mentoring programs, everybody's kind of doing their own thing. He said, we at the United Way started this thing called the Community Impact Agenda, and we were thinking about it as cumulative impact. They were making their grantees collect the same data points. And that was a huge step forward. So they had 80 programs that they were funding in after school, for example. They had to collect the same 20 data points that they've now narrowed down to 5. But at least that gets them swimming in the same direction. He said, what I think we're trying to get at, we were calling it synergy at the time. Synergy. I wonder why that didn't go over. But collective impact did, and essentially the line is, how are we going to get all those same programs that are working towards common outcomes, different programs working towards common outcomes, to work from the same game plan? That's what we were really working towards. And so conceptually, this probably bought us a year, because a lot of leadership in our community were like, I can't get my mind around it, right? I can't get my mind around what we're trying to accomplish. We put this up on the wall, it was just drawn, and all the leadership was like, okay, I want to get to the same game plan, all right? I'll give you some time to figure that out, right? So that's one thing. It's just getting the conceptual underpinnings of this down. But we've come to understand that most people were defining the same game plan as collaboration, right? And most of the communities that we now go into, because I handed off the local work in Cincinnati to a colleague of mine, and now I have the privilege of working with communities all over the country who are trying to figure this out. Most of the communities we go into, when we first have a discussion, they raise their hand and say, I'm already doing that, right? And they very well may be. When we dig a little bit, we said these are the big difference. The first one is the collaboration. You're typically convening around a program, right? Or an RFP, right? How many of you have been a part of a collaboration that was around an RFP? You know what I'm talking about? Request for proposal? Collective impact, you shouldn't be coming around any table just to get money. We actually think that that works counter to collective impact. If you bring people together to move a dial, that's a totally different discussion, right? You say, we want to move kindergarten readiness. Let's bring all the right people together. And in the end, you're going to have the people that really want to move kindergarten readiness, right? That are going to find a way to get involved. The second thing is to say that collaboration is often about proving something. We want to be able to say that this works definitively. That's great, and I still think we need to do proving, but we really need to be using data every day to improve things, right? This is the idea of continuous improvement. And this is probably the biggest culture change, is to say that data is not, as Amy said, a hammer, but a flashlight, right? We would say, we had another mantra that was just love the data. And every time you brought data into a room, you try to get people to just say, love the data. Sometimes we even do a chant. Because most of the time people use it to beat people up or to tell them they're good or bad. The third thing is that collaboration is often the thing that gets added to your list, not the thing that's a part of what you do, right? And so I worked in Washington, D.C. at the largest public high school in Washington, D.C., and I was called the Peaceable Schools Coordinator. They gave me that job because I came out of the Peace Corps, right? And they thought, peace, this is awesome. And that job, they had no idea what it was. There was a rise in some gang violence and all these issues in the school, but they thought they'd hire somebody to try to figure that out. And almost every week, I would have somebody come up to me and say, I want you to sign on to this grant, right? And they'd say, it won't take any of your time, just sign on. So for a little while, I started to sign on. And then I very quickly started to realize that it did actually take a lot of my time. And all of a sudden, I wasn't doing anything effectively because I was doing everything, right? If we're doing collective impact effectively, you're actually using data every day, so it's actually informing what you do every day. So it's a part of what you do. It's not just one more thing you gotta do, right? And the last piece is that where you're often in collaboration advocating for an idea. I heard about something that worked in New York City or LA. I want to just make it happen. I'm going to try to make it happen here. In collective impact, you're actually looking at the data, right? Every single day, and you're figuring out what works, and then you're lifting that up as a community to say, this is what we need to be doing. Right? In Austin, right now, such and such is working. We're going to figure out how to get existing programs and systems to adopt those things that actually work. That make sense? So this was something big that we can now use in communities to help people begin to shift their thinking from collaboration to collective impact. Yes?
The statement is what you do. I'm not sure what it is that you're doing there.
Mm-hmm.
So I mean, you say, is it the using data is what you do? What is the?
It could be anything. Let me give you a couple examples, right? So the head of the University of Cincinnati was one of our biggest champions. She left and went to the State University of New York. She's the chancellor there. But what she could do as the leader was every single time she held a meeting, every time, I'm not kidding you, and she's still one of our biggest advocates. I was just with her in New York City the other day. Every meeting she held, she'd say, hey, I am Nancy Zenfer, I'm the president of the University of Cincinnati, and I just want to tell you that we are a part of something called the Strive Partnership. And we are focused on supporting the success of every child every step of the way from cradle to career. And I am pretty much that career partner, right? And it is my responsibility to get kids in and through college effectively, and that's what we're all about. Now, let me tell you what we're here to talk about today, right? So the role that she could play was reinforcing every day that we were about these outcomes that we were going to move together, right? That's what she could do every day, right? It could be that at the United Way, the head of a collaborative around early childhood education says, rather than just doing an asset map all day long, right? What I'm going to be all about is making sure that all you early childhood providers actually have the data you need to practice continuous improvement. That's what I'm going to spend money on, right? And so they actually now, every day, rather than doing these asset maps and simply convening people to talk to each other about really nice stuff, their job becomes, I'm going to make sure you have the data. So what you can do varies on who you are, but the bottom line is you're always trying to reinforce that you're trying to move these outcomes. And I'll talk more about the specific activities in just a second. Does that make sense? That's a good question. There's a lot of different things that when you're trying to create that connective tissue, there's a lot of different things that players need to do, whether you're a CEO level executive or whether you're a practitioner working on the ground. Right? Okay, so let me get to the punchline of all this. This was a visual that we had to create. I do think it's really important in every community that we worked with that's had real success with this, and they have developed some sort of visual that gets people out of the schoolhouse model when it comes to education. And this was ours. It essentially said that learning starts at birth, it goes through some form of college, there's academic benchmarks and social emotional benchmarks that kids need to hit, and it's our job to make sure that we do whatever we can with every dollar that we spend to get more kids to hit every one of these benchmarks, right? And other communities have taken this, and I know in Houston they put stars on it, which we thought was very appropriate for Texas, right? But you know, communities have taken this and done all kinds of things with it. They've added things down here that were important to them, or academic benchmarks. Some have added health benchmarks and various things and so forth. Some have made it into a circle, and that's fine. But we really do think that it's critical to create some sort of visual that helps get people's minds around it. But this is really the punchline for us. And this, based on all of our work, Houston being one of the early sites, Portland, Richmond, Virginia, and a few other places, we essentially began to realize that there were some critical components. The do is what I think you're asking about, that things that you have to do differently in order to get this right. And this framework is our way to capture that. And we don't call it a model, very much intentionally. We actually think the concept of models is flawed. Right? You can't necessarily pick up what happened in Cincinnati and drop it down in Houston. They're quite different, for those of you who didn't know that. But you can translate some of the lessons, right? And there's essentially 4 key pieces of this work, pillars as we call them. First is shared community vision. Next, evidence-based decision-making, collaborative action, investment, and sustainability. And in each of these, there are different things that you have to do, right, to get back to that question. In shared community vision, there needs to be cross-sector engagement. You've got to have a set of cross-sector leaders that come together regularly, and I'm not talking once a year. Right? We had our leadership body, we presidents and CEOs coming together monthly at 7 a.m. for 2 years. They committed that time. I don't necessarily think you got to do that, but we were slogging our way through the swamps, as Lincoln called it. But you've got to have a structure. We don't call it a governance structure, an accountability structure, where all of these different players are actually working together consistently over time. And it's not just about the leadership table, it's also about the networks of providers, it's also about the policymakers, the funders. All of this has to fit together into that networked entity so that everybody's actually holding each other accountable for results. That's the first piece. Okay? The next piece is evidence-based decision-making, which is to say, in your community, you need to pick the right outcomes for you. So in Cincinnati, I listed 8. Some communities have up to 20. We think that's too many, but that's okay. They don't care what we think, to be honest with you. To them, that's what made sense. In every community, you've got to have a list of outcomes that you're willing to consistently report on over time and say, we're going to hold ourselves accountable for these outcomes collectively, right? Shared accountability. And we're going to eventually develop this comprehensive data management system. And that's some of the stuff that Amy was talking about in there. And that's probably the least sexy